Hello, everyone. Thanks for taking some time to talk through Dr. Tobaz's uh, basically wish to implement informatics with AI and precision medicine. And so that's why we're here, is to talk about how do we do that with the future directions in healthcare informatics. Our whole purpose is to go ahead and figure out how do we implement precision medicine and AI in clinical practice with our own patient population. So a couple things is understanding the difference between precision medicine and personalized medicine. A lot of times they get used interchangeably, but in reality, precision medicine is going to be focused on tailoring medical treatment to the specific characteristics. So it's more molecular than it is holistic. Things like personalized medicine include lifestyle, which can be a part of precision medicine, but we're going to be focused on things like very specific testing and disease management. There's more data intensity with precision medicine. Typically, it's going to require more molecular profiling than just an overall view of the person. And then it'll help us make more applicable treatment decision making. And as a clinical practice, this means better outcomes. So, as far as data collection protocols, it's important to understand how AI should be working. That can be kind of a scary term with where healthcare is today. It's not meant to be something in lieu of, it's supposed to be supportive of us as a care team. So AI leverages sophisticated computation to help generate insights. So think of it more like machine learning. We're going to use AI in clinical practice to help take the data and make something meaningful out of it so that us as a care team can do something with it. Knowing that, that sort of sets the stage for data collection protocols. And so the first thing we need to do, especially since we're dealing with PHI, is obtain legal and ethical consent. So as we implement this without practice, the patients and us as care teams need to make sure that everyone understands we're going to get consent from patients. A lot of this is going to depend on medical histories, genetic data. We'll talk about that use case later, about how to obtain and apply very specific use cases and pilot programs with genetic data. But if you want to really maximize AI and machine learning to do this, genetic data becomes pretty paramount. Getting a true diagnostic history and report, and then also making sure that we have in our protocols are data secure, and also implementing quality assurance and patient communication. So that's data collection protocols as a whole. It starts from the top and down. And then as we look at data security and privacy in general, there's a lot of concern with HIPAA. Now, there's some different implementations that we can do, but because we're dealing with disparate data sources, there's some standards we can focus on. So my recommendation would be that there's certain minimums we can leverage. It'll be different between other clinics and reference sources as we're collecting this data and these charts. We all know how that is, whether that's referrals or gathering from the health information exchanges. SOC 2, I would say, is the minimum requirement. HL7, we can go off of FHIR, and what that means, really, that means we can deal on a standard regardless of these disparate systems. So as we're dealing with these vendors and the places with interoperability, there's really kind of two parts: the clinical standards that we know we need to meet, but then the technical standards. If our vendor relationships and even internally are at least SOC 2 and FHIR on standards, then we can even deal with health systems on a high trust scenario. But basically, we can rely on the way that we exchange information at least has some kind of standard regardless of legacy systems. So that should be enough to account for privacy and security considerations. And so patient selection for a pilot with our clinic should be with the most high impact, meaning of all the patients we could see, if we want to apply AI, where we're going to have the biggest impact on the population, I would say oncology. There's actually an AI-driven program that I think is really safe. It's called Clarified Precision Medicine. But they quoted that accessibility to expert opinions is key to ensure that the promise of precision medicine is fully realized for oncology practices and their patients. Really, we're saying if we're going to apply what we believe to be precision medicine, let's take the most costly scenario of applying a treatment protocol to a costly health protocol of a patient to get the best outcome. And oncology makes a lot of sense. What I liked about client, partners like potentially a Clarified Precision Medicine is they also let us as a care team stay in the driver's seat. So they're using AI, like we have talked about, on aggregating the data, but it is backed by actual clinical teams and reviewers who are going to make sure that there's eyeballs on what's happening. We're only automating manual workflow, not the clinical precision that we need to perform. So we're talking about data security and protection and actual true outcomes, all in line of protocol and payer selection. This meets the threshold. And so this becomes really critical, I think, as a pilot program, high impact, insured reimbursement on a very vulnerable population. On oncology would be a really good choice where there's already players who are willing to participate with us. And so when we're talking about, once we do this, a treatment plan development, we can leverage the AI predictions to customize medication selection and dosages. So as a treatment plan development, we do the plan, we do documentation and consent. So once we understand what's really dialed into them on a molecular level, here's what we need to do, and we gain their consent and then implement and start monitoring. It's really important that we really do kind of get on the molecular level. There's a lot of programs, liquid biopsies, pharmacogenomics, things that are really, and in fact, frankly, even on PCR testing, so polymerase chain reactions, which is saying we're going to get down to what actually works for you, down to your infection and or treatment protocol. And then we need to implement a post-treatment way to analyze the effectiveness of the plan against the predictions. This is so we would call that the feedback loop. So I'd say from a treatment plan development, those would be the steps as a part of the protocol in understanding how we're going to measure actual patient outcomes and effectiveness with AI and precision medicine applications. Now, for us and future expansion of physician and staff training, we all need to have really a foundational knowledge of AI. And let's be frank, like actual tool sets within the workflow, we've all been exhausted with vendor fatigue and software programs. This would help us understand how to apply the tools and trainings against the protocols as a practice, and then assess that after the fact. And so after this really comes the magic moment of patient monitoring and outcome assessments. One, we would leverage patient progress using real-time data right from AI analytics and patient feedback. This is important that there's outreach programs, also just follow up. There's a lot going on to make sure that what happens in between visits is monitored and captured. And then from an outcomes perspective, understand changes in disease status or progression, or as a part of the protocol that we've avoided things like adverse drug reactions. That's really the true success of implementing AI and machine learning into our environment as clinical practice. And then gathering feedback and public awareness. So there's a few ways to do this, and they should be in tandem. One, we should definitely have surveys, but to do this in a friendly way. No one wants to be bugged like they are at retailers saying you fill out the survey. It needs to be part of our clinical practice program. So we're asking the correct questions, patient interviews while they're at the point of care. So they're in front of us and we're getting honest truth with actual considered feedback. And then we should consider a public series. At the end of the day, just like us as care teams are still trying to navigate and augment to this new world of AI and precision medicine. So is the public. And so just throwing on some online, maybe unaware seminars might not be enough. We probably need some public series with credentialed doctors from our own practice and other industry experts to create a series of information. So following all of this from data, AI, protocol implementation, how we're going to tackle it from a secure standpoint with our vendors, and then all the way through public feedback and awareness really should be our standard as a care team to get this clinically applicable in a short time frame. And if you guys want to take a peek, a lot of the things that we can look at are, I referenced Clarified. We also have the NIH and also those FHIR standards. Thank you so much.